When it comes to finding the best Medicare Advantage plans for 2026, the truth is most people don't even realize how much the differences between plans can change their entire year, financially, medically, and even emotionally. And that's why I really want you to stay with me through this video, because once you understand what's actually happening behind the scenes in 2026, you'll see why choosing the wrong plan can cost you thousands, while choosing the right one can actually make your life easier than ever. Before we dive in, I want to ask you for one thing. Comment your name and state below. I'd love to see who's watching and benefiting from these videos. I go through every comment, and it honestly means a lot knowing where everyone is tuning in from. Now, let's talk about the best Medicare Advantage plans for 2026, but in a way that makes sense, the way you'd explain it to a friend over coffee. Because this isn't just about insurance, it's about your doctors, your medications, your hospital bills, your monthly budget, your peace of mind, and frankly, your ability to feel secure in your own healthcare. Every year Medicare Advantage plans shift, benefits change, networks get updated, prior authorization rules tighten or loosen, and drug tiers get shuffled around. But 2026 is different. We're seeing some of the largest updates in the last decade. And those updates are affecting which plans rise to the top and which ones quietly fall down the rankings. And I want to say this early, there is no such thing as one single, best, Medicare Advantage plan for the entire country. What we actually have are best-performing carriers and best-performing plan types that consistently deliver stronger results across most states. And then from there, the best plan for you depends on your prescriptions, your doctors, your travel habits, your health conditions, and even the county you live in. But with all that said, yes, there are clear winners for 2026. Plans that have stepped up, gotten more competitive, and are offering real value instead of flashy gimmicks. I want to start with something that isn't talked about enough: how much 2026 Advantage plans are shifting their extra benefits. Everyone looks at dental, hearing, vision, and OTCs, but what they don't realize is that these benefits get inflated or reduced depending on how much the plan is quietly spending behind the scenes on hospital care, specialist visits, and chronic condition management. And this year, dental is one of the biggest differentiators. Something interesting is happening. In 2026, more Advantage plans are moving toward comprehensive dental with higher annual maximums. Not the $1,000 or $1,500 caps that vanish after a root canal, but real $3,000 to $5,000 per year coverage in certain markets. And the carriers offering these stronger benefits? Those are the ones showing up again and again on the best plans lists across the country. But let's slow down and walk through why certain plans stand out. Imagine two seniors, Mary and Joseph. Both healthy, both living on a fixed income, and both trying to choose the best Advantage plan for 2026. Mary picks a plan because the TV said it had extra benefits, free dental, free vision, all the things that sound amazing. Joseph picks a plan because he checked the network, looked at the drug formulary, and made sure his doctors were in. A few months later, guess who's paying unexpected bills? Mary. Because she chose benefits over stability. The best Medicare Advantage plans for 2026 have three things in common: strong provider networks, predictable costs for specialists and hospitals, and drug coverage that doesn't shift your medications into expensive tiers. Dental is a bonus, but in 2026, a surprisingly big bonus. Now here's where people get misled. You'll hear advertisements talking about the $0 premium plans like they are the holy grail. But a $0 premium plan only matters if the network, drug list, and out-of-pocket limits protect you. Otherwise, you're paying later in bigger, scarier ways, like $350 specialist visits or $400 per day hospital copays. In 2026, some carriers tightened their networks to manage costs. Others expanded. And some added telehealth and supplemental chronic support programs that are genuinely helpful, not just marketing words. So who's actually showing up at the top? Across most major states, three carriers continue to rise: United Healthcare, Humana, and Aetna. Not because of ads, but because their networks, formularies, and supplemental benefits stayed competitive throughout the last changes CMS rolled out. But that doesn't mean every plan from these carriers is a winner. What it means is, when you see these names, you're generally starting in the right neighborhood. Now, something a lot of seniors miss is how different these plans act for someone with chronic conditions versus someone who's relatively healthy. For example, a diabetic senior may need insulin coverage that stays at $35 or lower all year, reliable podiatry access, and kidney checks that don't cost $50 per visit. Meanwhile, someone who rarely sees the doctor might care more about dental, eyewear, and gym memberships. The strongest plans in 2026 do well for both. They balance medical and non-medical benefits. But here's something new. More Advantage plans are starting to adjust their drug tiers in 2026 because CMS is pressuring them to simplify their formularies. You'll see some plans lowering the cost of certain generics and raising the cost of others, so a plan that was great for you in 2025 might quietly stop being a good fit. That's why the best plan is always the plan that fits your specific health profile. And I know, this can feel overwhelming. You're bombarded with mailers, commercials, phone calls. Every plan claims to be the best. Every plan claims to save you money. But if you strip away the marketing and the noise, what truly makes a plan one of the best in 2026 is its ability to protect you from the unpredictable. Because the real danger isn't the premiums. It's what happens during a bad year. A sudden surgery. A new medication. A specialist referral. And that's why we're going through this today, so that you're prepared, and so that you don't find yourself stuck paying more than you should simply because you picked a plan with shiny benefits instead of solid coverage. Now, before we go deeper into which plans consistently come out on top, I want to bring you into a real-life moment that I see all the time. A gentleman recently told me, "I thought all Medicare Advantage plans were mostly the same." And honestly, many people think that, until something goes wrong. Until a hospital bill shows up. Until a medication that used to cost $0 suddenly jumps to $47. Until the primary doctor they've been seeing for 10 years quietly stops accepting their plan. And this is why finding the best Advantage plans in 2026 isn't just about comparing benefits, it's about understanding how Medicare Advantage companies actually operate behind the scenes. Some carriers in 2026 expanded their networks significantly. Others quietly reduced them. Some improved their dental maximums, while others tightened prior authorizations. Some plans improved insulin coverage, and others cut back transportation or meal programs. The plans that do well, and the ones I'm including as best, are the ones that kept stability while still increasing benefits. One thing I've noticed this year is that carriers are competing more aggressively on out-of-pocket limits. And you'll see plans ranging from as low as $2,900 in certain HMO markets all the way up to the CMS maximum of $8,850. The best performing plans in 2026 keep those limits low because they know seniors are living longer and facing more chronic conditions. Let's talk about a scenario you might relate to. Imagine you're traveling, or you're visiting grandkids out of state. Maybe you're someone who likes RV trips, or maybe your adult children live across the country. The best plans stay strong not only on local networks, but also on nationwide urgent and emergency coverage. Some PPOs even allow national in-network access. These plans are climbing the ranks in 2026 because more retirees are mobile than ever before, and carriers finally realized it. Now let's look at medications, because this is where 2026 is shaking things up. The Inflation Reduction Act continues rolling out changes, which means insulin stays capped, catastrophic phase is eliminated, and more medications fall under Part D price negotiations. But that doesn't mean all plans treat your prescriptions the same. In fact, the plans I consider best in 2026 almost always have wider drug lists, more Tier 1 generics, better pricing on chronic condition medications, less aggressive prior authorizations, This is one of the biggest differences between top-tier plans and average plans. If a carrier consistently moves your medications up into higher tiers, that plan should not be on a 2026 best list. Now, let's talk dental, because in 2026, dental benefits are becoming one of the clearest indicators of a strong plan. Plans with $3,000 to $5,000 in comprehensive dental, including root canals, crowns, dentures, and implants, consistently rise above plans that still limit you to basic cleaning level coverage. And one thing that makes a plan stand out is whether they use open networks for dental, you pick your dentist, or restrictive networks, you pick from their list. The best plans give you more freedom. But I want to bring this back to real life so you can visualize how this affects someone's year. Picture a senior named Robert. He's fairly healthy, sees the doctor a few times a year, but needs a few expensive dental procedures. Under a weak Advantage plan, he'll pay out of pocket and end up with bills in the thousands. Under a top 2026 plan with strong comprehensive dental, he pays almost nothing for the same procedures. And the crazy thing? Both plans have $0 premiums. The difference is the structure. Or imagine a woman named Linda who develops a heart condition mid-year. She suddenly needs cardiologist visits, testing, and new prescriptions. Under a weak plan, each visit hits her with a $50 copay, the prescriptions move into higher tiers, and her out-of-pocket costs fly upward. Under a strong 2026 plan, she pays much less per visit, her medications stay affordable, and her MOOP limit is lower so she never gets overwhelmed. This is why choosing the best Medicare Advantage plan in 2026 matters. It's not about January. It's about July. It's about October. It's about the moment your health unexpectedly changes. A good plan supports you. A bad plan punishes you. And this brings me to something I emphasize every single year. Never pick a plan just because your neighbor has it, or your friend has it, or because you saw it on TV. You pick a plan because its drug list matches yours, its network matches your doctor's, and its out-of-pocket structure matches your real needs. But what I can tell you, based on 2026 benefits across the country, is that certain carriers consistently outperform the others. And those carriers, and their top plans, are the ones we'll talk about next. But I want to transition into something more important than just rankings. Let's talk about why these carriers are performing so well in 2026. It's because they understand something most seniors don't realize. Medicare Advantage plans aren't created equal, because the companies behind them aren't spending their budgets equally. Some companies invest more heavily in preventive care, dental, diabetic support, and reducing member costs. Others invest more heavily in marketing and enrollment pushes. The ones that prioritize members over marketing are the ones that show up at the top again and again. Now you might be wondering, so which plans are we talking about specifically? And we're going there, but I want to be sure you understand why these plans made the list so that when we talk specifics, it makes perfect sense. In 2026, the carriers that ranked the strongest did two things. They kept networks stable instead of cutting providers. They improved benefits without increasing out-of-pocket risk. A lot of carriers offered flashier benefits this year, but the best plans improved quietly and strategically, in ways that actually matter. And you know what's kind of amazing to watch? Every year I see people who thought they were stuck with the same plan forever, suddenly realizing they can completely reset everything during AEP and pick a plan that actually works for the way they live now, not the way they lived back in 2018 or 2020. Medical needs change. Medications change. Doctors change. But most people don't change their plan because they assume the hassle is too big. And that's how benefits get lost, copays creep up, and networks shrink under their feet without them noticing. I always think of Don from South Carolina. He emailed me last year saying, "I don't think I'll ever find a plan that lets me keep my cardiologist because they keep dropping him." And for years he stayed stuck. But during the last AEP, he finally let someone run the new 2025 and 2026 plan options for him. And sure enough, there was a PPO plan that not only kept his cardiologist in network but also lowered his out-of-pocket max by almost $2,000. He stayed stuck for years because he just didn't know better choices existed. And I promise you, there are millions of people just like him. That's why understanding the best Medicare Advantage plans for 2026 is so important. Not because one plan is perfect, but because some plans consistently perform far better than the rest, especially when it comes to dental, drug costs, doctor access, and travel flexibility, which are becoming the big themes of 2026. A lot of folks are shocked when I tell them this, but in many parts of the country, the highest-rated plans in 2026 aren't necessarily the plans spending the most money on advertising. They're actually the plans that quietly built stronger provider networks, added richer dental benefits, and negotiated outpatient cost reductions. These are the plans most people never look at because they assume the flashy commercials must mean better coverage. But here's the truth. The plans spending the most on commercials often spend the least on your benefits. When we look at star ratings, member satisfaction surveys, and the 2026 benefit filings, a pattern starts to appear. The top plans usually fall into one of these types. Regional PPO leaders, strong networks, low specialist copays, surprisingly good dental. Integrated care systems, plans tied to big health systems with coordinated care and low hospital costs. Value-based MA plans, not flashy, but extremely stable benefits year after year. Zero premium plans that don't cut corners, rare, but they do exist in certain counties. Let's talk about dental for a moment, because 2026 is the year this benefit finally becomes real. For the first time, I'm seeing plans offering $2,000 to $3,000 in comprehensive dental, and they're raising annual maximums and expanding coverage for implants, which is a huge deal for retirees. Dental is the #1 benefit people complain about, and 2026 is the first year I feel comfortable saying, okay, these plans are finally listening. But not all plans are created equal. Some of the worst plans in 2026 are doing something very sneaky. They're advertising $3,000 dental, but then splitting it into two parts, only $1,000 for the services people actually need, like crowns and implants, and the rest locked behind restrictions or small networks. You'd be amazed how many people get tricked into choosing a plan that never intended to pay for the dental they were promised. So how do you know if a plan is best for you in 2026? It's all about matching your personal situation to the plan's strengths. For example, if you're someone who travels between states, or you spend winters in Florida and summers up north, then the best plan for you is almost always a PPO. And not just any PPO, one that offers nationwide access or multi-state networks. There are a few carriers doing this extremely well in 2026, and they're making it easier than ever to get specialist care without needing a referral. That's a big deal for people who hate paperwork, waiting rooms, and the back and forth between primary doctors just to see a specialist. But let's say you're someone who mostly stays in one city, sees the same doctors, and wants a plan that handles everything for you under one roof. In that case, some of the HMO plans tied to large health systems are absolutely the best choices for 2026. They tend to have low hospital costs, better care coordination, and richer extra benefits, because they're managing the whole system, not outsourcing pieces of it. One thing I've noticed across thousands of plan reviews is that the best plans for 2026 rarely require referrals anymore. That's becoming a selling point because carriers finally realize how frustrated people are with gatekeeping. And if you've ever waited 3 weeks just to get a referral to see someone you already know you need, you understand the frustration. Prescription coverage is another major factor for 2026. Plans now have access to updated drug negotiations, especially for insulin, oral diabetes meds, and certain cardiac drugs. That means your best plan in 2023 or 2024 might not be your best plan anymore. The 2026 drug tiers changed dramatically, and some plans slashed costs while others quietly raised them. That's why reviewing your medications each year, even if your premium is $0, can save you hundreds if not thousands. Now let me tell you about Patricia. She's 71, lives in Texas, and for years she stuck with a plan she chose back in 2019 because it was zero premium and it worked fine. But when we looked at the 2026 benefits, her plan silently raised her specialist copay to $45, while another carrier offered $20 copays and added a $2,500 dental allowance. She switched during AEP and emailed me later saying, "I didn't realize how much money I lost by not reviewing my plan earlier." And that's the message I want everyone to hear: sticking with the same plan can cost you more than switching. As we get deeper into the 2026 Advantage landscape, the biggest trend I'm seeing is this. The best plans are the ones that improved benefits without raising your out-of-pocket risk. A lot of carriers added bells and whistles, grocery cards, utilities help, dental boosts, but they raised the maximum out-of-pocket. And that's where people get tricked. Because if your plan covers more extras but increases your financial exposure by $2,000 or $3,000, is it really a better plan? Probably not. The truly best plans for 2026 are doing all three of these things. Lowering specialist and hospital costs. Expanding real dental coverage. Keeping nationwide access flexible for travelers. And if you can find all three in one plan, that's usually a sign you're looking at a top-tier option. Another thing I love about the 2026 updates is how much focus there is on preventive care. Plans are expanding screenings, early detection tests, and chronic care management programs. Some plans even offer blood pressure monitors, glucose devices, and nutrition programs at no cost. And the reason is simple: carriers finally realize they save money when you stay healthy.